ASPS reported there were over 100,000 aesthetic and reconstructive breast reductions performed in 2012. Although this procedure is increasingly popular, there are still perceived gaps in the literature, as well as some controversy on best practices. Fortunately, in the July Cosmetics section, you'll find 2 articles that attempt to quantify outcomes and address the lingering debates about this complex surgery. Join me in today's discussion are Doctors John Tebbetts and Achilles Thoma with a highlight of some of these issues. Thank you for joining me today, gentlemen.
Thanks for inviting me, Rod.
Thank you, Rod.
Today, we have an opportunity for a healthy debate and discussion on aesthetic and reconstructive breast reductions. Let's try to find out what these 2 articles can add to our general understanding of both procedures. John, in your article, you applied 20 plus years of outcomes data generated by your quantified process-based approach to breast augmentation to provide a more objectively defined approach to mastopexy and reduction. What, in your view, John, is missing from the breast reduction literature or the mastopexy literature, and how do you try to fill that gap?
Rod, from my perspective, what continues to be missing in breast reduction and mastopexy is objectivity in every stage of the procedures. Objectivity in tissue assessment, objectivity in technique selection, objectivity in operative planning, and objectivity in assessing clinical outcomes. Instead of having an either-or mentality for choosing a technique, we need methods to objectively define the pre-op breast by measurements, and then, using defined processes, objectively define what we're shooting for in a desired result. And then finally, assess that result using the same objective criteria throughout the entire process. I'm trying to address that gap by defining a technique-independent framework of objective measurements and processes that surgeons can apply to nipple positioning, skin envelope modification, and parenchyma redistribution or removal in mastopexy and breast reduction in this series of papers.
Now, Achilles, your high level of evidence article looks at a randomized control trial of over 250 patients to settle the debate over the superiority of the vertical scar incision reduction technique versus the inverted T-shaped reduction technique for breast reduction surgery. How were you and your team able to settle this debate, Achilles?
This debate was settled by choosing the highest level of evidence study design with robust methodology. We assessed the quality of life of patients undergoing the 2 techniques with validated instruments and using the patient's perspective. The RCT design eliminates many biases which are present in many case series reports. We set a time horizon to measure the outcome at 1 year. We found that both techniques are equivalent.
Both of your impressive works came to conclusions about both breast reduction and mastopexy from what I would call a diametrically opposed philosophy in plastic surgery. So Achilles, what do you think of Dr. Tebbetts' article, and what does that add to your understanding of breast reduction or mastopexy surgery?
Dr. Tebbetts' article will help us standardize breast reduction and mastopexy in a predictable manner. The importance of objectively assessing the relationship between the nipple inframammary fold distance and breast base width is not generally known. His described technique will help us position the nipple and deal with the skin redundancy in the horizontal and vertical planes in a more predictable manner. I'm not presently using this technique, but I will try it on my next patient. I'm looking forward to Dr. Tebbetts' future publications that deal with the management of the parenchymal tissue of the breast. In addition, I'm looking forward to evidence-based evaluation of his results, not just by tape measurement alone, but by using validated quality of life scales from the patient's perspective.
And John, what did you take away from Dr. Thoma's evidence-based article as well?
Dr. Thoma's study is very well done, and it indicates that government-funded breast reduction patients in Canada perceive equal quality of life with vertical and with inverted T reduction techniques. In my practice, it's a bit different. I try to select the most effective technique based on patient tissue measurements and the quantities of excess skin in the breast. All of my patients are private pay, and most are intolerant of prolonged time for resolution of scars, wrinkled areas, and they're even more intolerant of revisions. As readers will see in my papers, I therefore base technique selection on strict objective measurement criteria that define skin excess ranges. Most importantly, I define the desired result by dimensions, then adjust nipple position, the dimensions of the skin envelope, and the amount and distribution of the parenchyma to meet that defined goal. And then finally, most importantly, I assess outcomes using exactly the same measurements throughout the system.
Very interesting. Thank you both for joining me. It's refreshing to hear both reconstructive and aesthetic viewpoints come together on such a topic-oriented discussion. I hope this point and counterpoint has broadened your understanding and critical knowledge of both breast reduction and mastopexy surgery. From such large evidence-based trials to single surgeon multi-decade experiences, our best and brightest surgeons are working every day to improve patient outcomes and their lives. I also hope that you will join in this discussion started here by continually learning, discussing, and debating the art and science of plastic and reconstructive surgery.